Hello, this is Dr Helen and Welcome to our GenderGP Podcast, where we will be discussing some of the issues affecting the trans and non-binary community in the world today, together with my co-host, Marianne Oakes, a trans woman herself, and our head of therapies. Hi everybody, I'm here with Marianne as usual, and we have a very exciting guest with us today who's from quite a long way away. I'm with Sofie Lasiuk, and she's in Toronto. I'm not going to tell you anything more about her. I'm just going to pass you over, as I like to do. Sofie, introduce yourself. Tell us why you're here, and give the listeners a little taste of what we're going to talk about.
Of course. Well, first of all, I'd like to thank you for inviting me on your podcast today. So I'm a 52-year-old woman. As you said, we live in Toronto, Ontario. And I've been following your posts, Doctor, for several years now and reading up on some of the problems that people tend to have when transitioning in the UK. And it occurred to me as I went through my own transition over the last 3 or 4 years that the systems in place in our two countries are markedly different. And I wondered why that was, and I can't figure that out. The system in place in Canada has been so welcoming and so user-friendly, for lack of a better word. And I just wanted to reach out to you and express how the differences have been helpful to me, and perhaps start a conversation on your side of the Atlantic about how things can be improved over there.
Well, I think that would be amazing. And yeah, I want to say thank you to you for reaching out to us in the first place and for making that first contact. You sent me some brief messages, which I always love receiving. And then you wrote a blog for our website just explaining how it was for you. So if anyone hasn't read that yet, then there's maybe some spoiler alerts in there. And I was astounded. I was like, goodness gracious me, this is what we've been campaigning for the last kind of 5 years, and you're there already. So just outline how, you said that you're in your 50s. How did it go for you from the first time when you wanted to actually go and ask a doctor about this?
So my truth is that I have identified as female since my earliest memories. I'm in my 50s now. So 3 or 4 years of age, I had this innate understanding of my gender. And I've carried that with me all my life. And society certainly has had some catching up to do. And over the last 10 years or so, certainly including my wife in discussions, we decided it was the right time for me to move forward with my gender transition. So I did approach my doctor in 2016, I believe it was, early 2017, to get assistance, medical assistance to move forward. And I've had nothing but good assistance and helpful assistance from the entire medical establishment, and has certainly made my life a lot easier to do so.
Well, that just sounds a bit too easy to be true, doesn't it, Marianne?
It doesn't compare to my experience here in the UK, if I'm honest. So I think I went in 2013 to see my GP, and I didn't get to have another conversation about anything until 2016. And then it still took another 18 months before I got any treatment. So and it was arduous. I can't say any more than that. So just listening to you talk and listening to your experience, yeah, I'm envious, if I'm allowed to say that.
Marianne, what happened in those 3 years between the 2013 and 16?
What happened was a black hole of nothingness. There was no contact. I got one letter a month after I got referred to the gender clinic. I got one letter just say acknowledging the referral. And they got me to fill in some details, preferred name, and, I don't know, just pithy stuff, really, that I would expect them to have known anyway. So I filled that in, sent it back, and then nothing. And I just waited and waited and waited. And eventually I got a phone call, it was just before Christmas, to say that there'd been a cancellation and did I want the appointment. And I was in the privileged position of just being able to say yes. It was the day after the phone call. But yeah, apart from them two interactions, there was this black hole of nothingness, which isn't nice. I think that one of the things I would say is that, some people say no news is good news. When you're trans and you're waiting to start your journey, and certainly a medical transition, that nothingness is bleak. There's no other way to describe it. I'm dominating there. I apologise, Sophie.
No. I'd love to interject and tell you a bit more about how things played out with me. So prior to 2016, in Ontario, our trans healthcare system was kind of structured on the British system, where we had one gender identity clinic located at the Centre for Addiction and Mental Health in Toronto. So a mental health care center. So right away, that was a bit of a put off for a lot of people approaching that center. You had to be referred by your GP. And that center, the only center for 9 million people, was notorious for wait lists that went from months to years, and it was absolutely unacceptable. We went through a new provincial government earlier in the 2010s, and they were approached by advocates within the system and pleaded with to change the system. So they looked at best practices and said, well, why do we need this system in place? Why do we have a gender identity clinic? Why can't this be done with the healthcare provider that people are most used to, our GPs? So we have had the same family doctor, for close to 20 years. So she knew me very well. And I had a very good rapport with her. So when I approached her in, I believe it was January of 2017, I said, look, I haven't been entirely truthful with you. I identify as a woman, and I am trans, and I need your help to move forward with my transition. And she said, absolutely. She said, I don't have a lot of experience helping male to female patients. She says, I've had, maybe a handful of female to male patients, but I will look up best practices. And I gave her some information that was available from our Ministry of Health over the internet. It's available to everyone. And I provided her with that. She asked me for a couple of weeks breathing room to figure out what's going on, how she can help me in the best way. We made another appointment for 2 weeks after that. I came back. In the meantime, she said, well, you're probably going to need blood work if you're going on hormones. So she gave me a complete blood work that was part of my yearly physical anyways. So that was in place in 2 weeks. And she said, okay, we're moving forward if this is what you want. So she prescribed me a started dose of hormones, estradiol. She put me on spironolactone as a T blocker. And she gave me a referral to a well-known endocrinologist in the city who has experience working with trans people. I reached out to that endocrinologist myself and got on their wait list. And luckily, they had an opening within 2 months. I got in to see them. And so 2 months later, I was on a full dose of HRT and moving forward. And it's been nonstop since then.
So, I just had a warm feeling thinking that your GP that knows you best, that's known you and your family for 20 years, was the one to have that privileged secret. I feel really warm about that, actually. And also that you had such a lovely response, because we don't always get that response from GPs. We often hear the GP saying, oh, I don't know, that I haven't got much experience on that one. We often hear that. And we often hear our patients being armed with, sheets of information and what have you for their doctor. But some people just don't get that warm response that you had from your GP. I often give a high five on my podcasts, and I'd like to give a really nice high five to your GP for that, for doing that with you and helping you. It's lovely. I've got a question. You mentioned best practice a couple of times, and I can almost hear my GP colleagues over here saying, oh, no, this is not about best practice. What we want is research. We want evidence. We want proof. We cannot possibly entertain such an intervention as this on best practice. We need more figures and stats. So I don't know whether you have any insight into how what did you mean by best practice when you were talking about that? then.
So the Ministry of Health in Ontario put together online resources for the GPs, knowing full well that a lot of GPs and nurse practitioners would have very little experience providing assistance to trans patients. So they have a very good online resource in place, and they have information available through, I believe, a 1-800 number over here, where if a GP has any questions, they can contact the Ministry of Health and sort those out one-on-one. I don't know how the medical establishment determines what best practices are, other than the fact that what is already working for the thousands and tens of thousands of people that have already transitioned and are on HRT and are just living their lives. I mean, it's just data that you find from watching people live their lives. So the medical establishment would be better suited to answering that question as to how it's been determined that this is the best way forward. I know I did a lot of decades of research, and once the internet came on the scene in the early 2000s, it was a good and bad resource. There's a lot of bad information out there, but you sift through that and you listen to people and that are successful in their transition and are happy in their transition and what worked for them. And a lot of people, individuals, put their systems on the internet and said, this worked for me, this is working for me. So perhaps that is how the medical establishment has gotten their data. It's certainly something that I've been thinking about, as I said, all my life. So to tell me that I would need to wait another 2, 3, 4 years while they made sure I was sure of who I am, that doesn't make sense to me. I thought about this for years. I thought about this for decades. It took a lot of fortitude to tell my doctor my truth, especially knowing how people have been treated in the past by the healthcare system. When you are at that point where you have to move forward, and I had to move forward. It's as simple as that. We're ready. We just need you to point us in the right direction. We don't need you to hold us back. I had made sure I had very good psychological help. I had a trans-centric therapist that I had hired a couple of years before that. They helped me work through some of the questions I had, and they helped assure me that I was going to be fine. And that was very important to me, knowing that, yes, this wasn't going to destroy my life, that there was a light at the end of the tunnel for me.
I was just going to reflect there that there's something about when we go to see the doctor, and I'm not sure, and Helen will know better than I do, I'm not sure what it is, but it's a terrifying but a life-changing moment. And I sometimes think people don't actually get the magnitude when we share this information with them, the magnitude of that privilege. I don't know about you, Sophie, but I wasn't going asking them to determine whether I was trans or not. I was going telling them that I was trans and I needed help. I didn't want somebody else to then validate that for me. And I think that's the trouble sometimes when you approach somebody. Their automatic thing is, we'll need to get that diagnosed.
Yeah.
We can't help you till we've diagnosed that. And I don't know whether that's medical training. I'm sure Helen would know more about that. Or whether that's just I know nothing about this, so I'll panic and just default to that. I don't know. But I wasn't going for somebody to validate my gender. I'd already done that myself.
And I agree. Yes, I was in the same boat, 100%. And it would have been off-putting if my doctor said to me, well, I'm going to have to figure this out for myself and confirm that you're trans. I already knew I was trans. I knew my identity, and the professionalism and the compassion that I was presented with all along the way, it startled me. I was expecting a lot worse, and it is certainly emotional even thinking of the assistance I got and to hear people that don't have it as good as I've had it. I know I'm very privileged. I was very savvy about how to navigate our healthcare system. Younger people that are new to the country, they won't have that knowledge. And of course, their situation is going to be a lot more difficult. And we need to assist those people more, just as much as people are used to our healthcare systems, and make sure that they're given the guidance and the assistance moving forward that they require.
Yeah. Marianne, you were going to say something?
I was just going to say, I couldn't fault the professionalism of the doctor that I spoke. He handled it sensitively, but it defaulted to, we're going to have to refer you to the gender clinic. And actually, I was only after HRT. I never wanted surgeries through the NHS. Doesn't mean to say I wouldn't do in the future. And but that was the get at, and he did handle it sensitively. But yeah, I think I'd have preferred to have had the response that you had.
Mm-hmm. I think it's really interesting. I mean, both of you ladies are of similar age, and not giving any ages away. Someone's just had a birthday, by the way. And you both told me the same story, that you knew who you were from when you were very little. So everyone else thought you were a boy, but actually you knew that you weren't. And then there were years of not addressing that. And then there was the time before you ever first went to the doctor to ask, for that snap decision that people seem to think is what trans people make. There was years and years of internal reflection, wasn't there, to work out what was the right thing for you, for your wives, for those around you. And Sofie, you said you did your own research, and what your research was into you and your gender and how you could make this work for you. And I think that's a really good point, that doctors are asking for research, for medical research, but the research that you people do to find out that this way is huge. You don't just wake up one day and go, do you know what, I think I might try a little bit of HRT and see what it feels like. It's just not like that, is it?
It certainly was not for me. There must be other medical situations where the doctor does not have a lot of experience dealing with a patient that's going through that situation. And I would hope that they don't hold off from providing care for years in turn for these other situations, because the outcomes must be dire. The research that I was able to cobble together, of course, was outside of the medical establishment, and just people putting their own stories online, and perhaps a few papers that had been published over the years and made available on the internet. Other than that, you grow up, and I grew up in the 70s and the 80s, and it's simply the terrible things you hear on TV, the terrible things you read in the mainstream media, the newspapers. And you learn very quickly to keep that hidden, that part of you hidden. And society, at least in Canada, has caught up with us, where now they understand that we are your sisters, we are your brothers, we are your wives, we are just your coworkers, we are no different than you. Allow us to live our lives, allow us to be productive members of society. That's all we ask. We're not asking for anything special. Thankfully, in Canada, we now have in place in the Canadian Human Rights Act and in our provincial Human Rights Acts firm protections for trans-identified people. And I did a lot of research before I came out at work with my coworkers, making sure I knew what my protections were. And I had that in my back pocket, but thankfully, I never needed to use that, because society has caught up with us, and they realize that we're no different than anybody else. And people that state differently, they seem silly now when you listen to these people voice their disagreements with our lived experience. So most of our coworkers, most of our friends, most of our family get it, and they're fine with it. And hopefully the NHS on your end can see through to that and also move forward with society.
Well, I think you made a very good point at the beginning of that little section there, saying, I wonder whether there are other situations where the doctor doesn't know much about it. And actually, as a GP, GPs know a little bit about everything. and a specialist knows a lot about a few things. And so actually this model that you described right at the beginning, Sofie, where you were saying that you went to your GP and your GP started you off on a small, safe, unscary treatment, and then you went to the secondary care, the specialist, for the kind of the full package. It's exactly the same as any other health problem. You know, if someone has bad arthritis in their knee, I can give them anti-inflammatories and painkillers, but I can't do any arthroscopy. I can't even do a scan or an x-ray. They have to go to the hospital. I certainly couldn't do an operation, you know? So that's the same. It's the same for everything. But for some reason, and I haven't met it in any other branch of medicine, for some reason, trans healthcare doesn't seem to fit this model. The GP feels allowed to say, I know nothing and I won't investigate any options for you. And secondary care, which is your local hospital, has been skipped entirely. And patients who've been referred to their secondary care hospital, like you went to your endocrinologist, if they're referred there, the referral is sent back saying, we don't deal with that here. You have to go to this super specialised clinic. So we have 7 in the UK. You had 1 in Canada. And of course, as you said, the waiting list is just, they can't cope. They can't cope with that many people. So what we really need is exactly the model that you've described, where the GP can start off just a little bit of something that they feel comfortable and safe with, and then it can get fine-tuned at the hospital if that's what we need. And you know, it's a model that's worked in healthcare for many years, and we just need to do that. The other thing, Marianne, I was thinking when Sofie was talking, is that there's been a lot of government help here, hasn't there? There's, you know, the resource, they saw that this was going to be a problem. They saw that GPs wouldn't know much about it, and endocrinologists as well, I imagine. And they thought to themselves, right, we need to put some stuff in place here. And that's what that's what we need in our country, isn't it, Marianne?
Without question. I mean, the issue we've got at the moment is there's a lot of talk of rolling back trans rights in the UK. My gut feeling is it's not going to happen. There's a lot of rhetoric, but not a lot's going to happen. But in terms of the healthcare, I think the trouble is there's too many profit from the old system. It was always dealt with as a mental health issue, and you said in Canada that's what they were trying to do, treat it as a mental health condition. And what they've done, thankfully, in Canada, and I'm hoping whatever happened in Canada does spread across the Atlantic, they saw that actually these people are just somebody's father, brother, sister, mother, that we are just people, and actually we're not crazy, that we've not got a mental health condition. And we just need some physical support through medication. And getting that to change here just feels like an impossibility at the moment. But my gut feeling is it's got to change because the waiting lists are going to force it to change.
Well, certainly in the early 2010s, we had the perfect storm of a compassionate provincial and a compassionate federal government who both listened to trans people and trans health advocates, and they removed as many barriers as possible to make these changes happen. And that was a lucky period of time where we were able to take advantage of that compassion within the levels of government. Thinking back 15 or 20 years previous to that in the province of Ontario, we had a very conservative provincial government in place that actually removed trans healthcare, delisted trans healthcare from our provincial healthcare system. And I'm sure it cost untold grief for people at that time. And again, I was just starting to consider moving forward with my transition. And the message I got from my government was, no, it's not worth helping you. So luckily that government is no longer in place. And we had the government support in the early 2010s that was able to help us move forward. But we are at the whims of our government, unfortunately, no matter where we are. And, it's easy to say you just have to wait it out. That's really hard when you're the person waiting out and your soul is being torn apart, waiting to move forward with your life. And I feel so sorry for people that are still in that position.
Yeah, for sure. And, the words you describe, both of you actually, you've said it a lot, Sofie, is living their lives, just living their life. We're not asking for a lot here. We're not asking for I don't know what to compare it with, but just asking to be allowed to live your life in the way that makes you and the people around you feel happy and comfortable, so that you can get the best out of your life, which actually, as we know, as we get older, becomes quite short, and time starts running out.
Yes.
And that's really important. It's scary that it can be so governed by somebody at the top. I was reading actually something quite interesting recently, that because obviously healthcare being so big, it's sectioned off geographically, even in the United Kingdom, which is not huge, geographically not huge. It's sectioned off, and actually doctors on the ground floor will ask someone higher than them, or someone more power than them, for permission. They might ask their local clinical commissioning group, what am I allowed to do here? Am I allowed to do this? And what the head of that clinical commissioning group in one area might say something completely different to another area. And if you have somebody a bit like your previous government who has a negative view towards providing gender affirming care, that can then filter down to ever such a lot of doctors on the ground floor. And that's a really scary thought, that one person's influence can have so much power over so many lives. And it's quite scary. For me as well, it's also about, that permission. Or is it sometimes a bit of an excuse where doctors can say, I don't know if I'm allowed to, let me ask, or I don't think my insurance would let me do this. I don't think my regulator would let me do this. I don't think my boss would let me do this. And I'm sometimes think, come on, you're the doctor here. You're the one with the medical degree. You can look this up. You can feel confident that you're providing the best care for your patient. Is it excuses, or is it permission that they're looking for? I don't really know. If there are any doctors out there listening to this who are cross with what I'm saying, please comment and let me know.
I know how fortunate I was to have a compassionate doctor. And that's when I was originally choosing a GP, I had gone through 2 or 3 different ones who I had a feeling moving forward that if I did come out, I wouldn't have gotten the support I needed to get. So I chose well. I urge people to choose their GP well, and you usually get a good feel for that person as a person, not just as a doctor. And if they're not the right fit for you, I urge you to look for someone else. I'm not sure how the system works in the UK, but we certainly are allowed to shop around, for lack of a better word, for a GP that clicks with us. And I was so fortunate to have one. And I do realize that a lot of people aren't in that position, especially in smaller towns where you may only have one doctor's practice to go to. At that point, what do? You're on your own. Luckily, I live in a city of 3 million people. I have endless doctors that I can search out. A lot of people, especially in rural Canada, and I'm sure it's the same in the UK, you have one choice, and if you don't like that choice in GP, you're traveling 2 or 3 hours to find someone else. And if you're a minor, if you're someone that doesn't have the financial means to make that travel, you're really stuck. And I feel for those people.
I was just going to take you back there, Helen, as well. You said something earlier, and it's just been going around my mind since you said it, that if somebody came into your surgery with arthritis on the knee and they limped in and they sat down, you wouldn't send them out without some kind of help, even if it was only anti-inflammatories and painkillers, and say, you'll have to wait for the specialist to help you. And I think, and I bang on about this, I'm going to apologise to the listeners, because probably I get it in every podcast we do, but when we walk in there, we are in pain. Mm. And the doctor is actually sending us out without any help. And you would not do it just because we didn't limp in. What they see sat in front of them isn't what our family are seeing at home, our disengagement with society, that our world's becoming smaller and smaller, and that the pain that we're causing to our family and the worry that we start causing them. Just to send you out of the surgery without, I'm going to fill up in a minute, but to send us out to the surgery without any help is it's not good doctrine, I would have thought, failing to see the pain and recognise it.
I couldn't agree more. And, a psychosomatic pain, which is, a pain from inside, not from a physical organ, but from a pain which really, really hurts. I will have said this before to you, but, psychosomatic pain is very, very, very real. It's like when you have a broken heart when your boyfriend leaves you. It hurts. It's a real, real physical pain in your heart. And we have to understand that this pain is really, really there. And Sofie, I love the way that, I wonder if your doctor knows that you chose her. Is it her? I don't know.
Her, yes, it is. Yes.
That you chose her. You actually chose her 20 years previously, just in case.
Just in case.
I absolutely love that image. I've got goosebumps just thinking about it. But Marianne, again, isn't it? We shouldn't have to choose our doctor or our therapist because of their trans-affirming views. And you're right, Sofie, sometimes we have to. And sometimes the advice we just need to give people is, if your doctor won't help you, just find one that will, because you've already got enough battles ahead of you and hills to climb, so don't make another battle. But we shouldn't have to, Marianne, should we? And finding the right counsellor, finding the right therapist, finding the right doctor, that seems like such a hard thing to do when actually you're in pain and you need some help.
It's a little bit invalidating as well, isn't it? The thought that actually you're going to have to fight to be heard. You want to go and see the doctor. I don't know, I might be being naive here, but going into a surgery, it's a sanctity of security where it's there purely to help, and actually to go in there and be made to beg almost. And it's the same with the therapy room. How anybody could ever walk in front of a therapist only to be told, I don't know anything about gender. Everybody knows about gender. We've all got one. You know what I mean? It isn't something that we haven't all experienced. We just experience it in a different way, that's all. So, we should, and you said about the battles. My heart sinks. The thought that we even have to think about this as a series of battles, it just says there's something wrong.
Yeah, even up to about 3 years ago, when I first went into my therapist's office, I begged her to teach me coping skills. I didn't think that I would be able to transition at that point. And she laughed at me, and she apologized for laughing afterwards. And she said, "You don't understand how this is moving forward. You have such you've gone such a far way just to get into this office. I will tell you that you are well on your way to transitioning already, and I will help you do that. And it's not the sense of coping skills and discipline, it's living your true life and all the pain that you've felt since then over the years." And she was right. And I put in the blog that I was in the driver's seat, and I still feel that they didn't push me in a certain direction, but they heard the direction I wanted to go, even if I wasn't listening to myself. And they were there with the right answers every step of the way. And, my doctor, my therapist, my endocrinologist, they're all, every time I see them, they go, "How are things going? Are you happy with the way things have progressed?" And I have a huge smile on my face. So that's the answer they need, is just that sense of elation and sense of happiness. And even my wife says that I'm a much happier person than I used to be. And we've been together more than 30 years now. So she knows me better than anybody. And that's how it is.
Well, Sofie, I don't know about anybody listening out there. I mean, I define anybody not to have a massive smile on their face at the moment, because I know Marianne has, and because I got the privilege of seeing her in front of me. And I certainly have. I don't think I could be smiling more broadly just at that thought of those three people giving you that chance to live your life in the way that you do, and actually caring about it afterwards. To could keep on asking, "How's it going for you?" I think that's just lovely. I was just wondering, and not personally at all, but what about things like voice therapy, laser therapy, surgery, fertility preservation, things like that? Is that easy, or are you going to shock me and say how easy that is as well? Or
The provincial healthcare system pays for certain things and don't pay for other things. Voice therapy, I did undertake at a local hospital with a voice coach. I had to pay for that, but that was reimbursed through my employer's health plan, so I didn't really pay for that at all. Hair removal, that's something that is out of pocket, and I have been going to a dermatologist for that since 2013. So it's been a long effort, and that is possibly one of the most costly parts of the entire transition. In terms of surgeries, that is covered by the provincial healthcare plan. In Ontario, and I guess it's the same in the rest of Canada, you have to be living in your true gender for 1 year before your GP can apply for provincial monies to help you move forward with surgeries. And she did fill out the paperwork for me. I required the GP's authorization on that, and I also required the word of two therapists, two separate therapists, and that was that was easy to get. I had already been going to see one therapist for several years at that point. The paperwork gets sent to the provincial Minister of Health, and I got a reply back in 2 months okaying the monies. And that gets CC'd to the surgery clinic in Montreal. Their healthcare team does a pre-surgery assessment. That took probably about 3 months, and then they called me back with a surgery date, which was 2 months after that. So all said and done, from the start of my transition, the surgeries I needed for me were completed within 2 years. And that seems to be on par for this province. There are other situations where you may not be medically in the best medical shape for a surgery, and of course, everyone's situation is different, but for me, everything fell into place, thankfully, and I was able to move forward in a timely manner.
Yeah, that's amazing, isn't it? I mean, so many questions come through our website saying, what do I need to do to get surgery? Do I have to go through the gender identity clinic? Is my GP allowed to refer me? And a bit like you were alluding to, Sofie, is that not all surgeries involve the really, really, really most detailed ones that are available. Some people just want some minor surgery just to realign their body with their gender. But no, it's almost, I've said this before, I know, but some years ago, somebody wanted to have some work done on their nose. And that was what their dysphoria was really strong about, their nose. And they had booked themselves into a local private plastic surgery hospital, along with all the other people who wanted to have a better shaped nose for them. And everything was going smoothly until the surgeon realized that this person was trans. And then they were like, whoa, no, hey, no, we can't do this for you today. No, absolutely no way. You have to go away and you have to get 2 letters. You have to validate your gender, Marianne. You have to prove to me that you're trans. I can't possibly do this nose reshaping for you. I just hold my hands up and say, goodness, whatever is going on. And, in the UK, GPs are not allowed to refer for gender affirming surgeries. We've got a long way to that one.
I almost wonder if it sounds like there's a fear that's instilled in GPs and in the medical establishment in the UK where people are afraid to assist. And I was wondering, Doctor, if that's a true feeling that I'm getting, that you're told in medical school that this is witchcraft or something, that you shouldn't touch, or you might lose your practice or something. I don't understand that mindset.
Well, that is honestly a really, really good question, because what happens in medical school is nothing. So I wasn't taught anything about gender identity at medical school. I expect I was taught that there was a male and a female, and you govern that by looking at the genitals at birth, and sometimes it might be a bit confusing. from looking at the genitals, but that was as far as my medical school training will have gone. And unfortunately, 25 years later, we're in a very similar position. Gender is not talked about. And if you look at postgraduate medical education, we have our curricula. So we have a curriculum for psychiatry training and a curriculum for cardiology training, a curriculum for endocrinology training. If you look at the endocrinology training, transgender is not mentioned. If you look at general practice training, there is one reference to the word transgender, and that is in explaining what LGBT stands for, So we're very, very, very limited in our education. So why are doctors scared? It's not because they're told in their medical education not to do this. They may have had kind of a personal opinion during their medical education from someone who was supervising or training them. We don't know about that. But we're floundering here because we're left to the media and what you read online and what you read in the newspapers. And actually in the UK, a very high proportion of doctors who provide transgender care have come under investigation and suspended from practice, just like myself, which, that's scary. That is scary. Who would ever want to do anything that might put your license at risk or put you through the courts?
Yeah, of course. It's and you mentioned the media, and I do follow the British media, and it is astoundingly vicious against trans persons. And as a Canadian, I don't understand that point of view or what the impetus is for that. The Canadian media, the Canadian newspapers, they don't even talk about it. It's not an issue because it's no longer an issue in Canadian society. We're just your neighbors. It's no more of an issue than talking about gay people or any other person on the LGBT spectrum. No one would read that column. It would be considered below a paper of record to put something like that in their pages. So it's very interesting to follow the British press and the viciousness that still exists over there. I don't understand it as someone looking from away.
I think the issue that we've got in the UK is that this is social change that we're going through. And we went through it in the 90s with the lesbian and gay movement, certainly where AIDS was concerned, the demonisation of gay men. And I kind of equate it to that. I don't know why. The only thing I do know is the more visible we're becoming, I think certain sections of society are a bit frightened by it. But I think overwhelmingly, and again, to the listeners of this podcast, just when I go out and about, I don't feel anything but love. I've not, touch wood, I've not had a bad experience yet. I've had awkwardness. I've had, sometimes somebody's misgendered me and there's a bit of an awkward pause. But generally speaking, what we read in the papers isn't what I always experience on the street. And I'm sure there'll be some people out there screaming, saying that they have, but I've not. I just wanted, actually, as the time's going on, if you don't mind, it's taken me a long time to ask this question, but how important was therapy for you in having a good transition, if that's not the wrong question to ask?
No, that's a very good question. And that was probably the most important facet of my entire transition. And one of the first persons that I approached was the therapist before even I approached my GP. Being trans certainly weighs on you heavily. It weighs on your soul, it weighs on your psyche. And there was a lot to sort out there. And we spent a good year talking about trans-related issues and how it affected my life and my outlook on life. And as a basis for talking about certainly other problems in my life where you're a one package of a person and being trans is just a small part of that. But without that therapy assistance and having a really good therapist, and I searched for that therapist just like I searched for my GP, and I made sure that they were a trans therapist where they advertised that they were really supportive of LGBT persons. That was so important, and I wouldn't be where I am now with that woman's assistance. And it's just part of the entire healthcare system. You have the medical side of things, you have the mental health side of things, and they have to click together, and you can't have one without the other. They're both equally as important in my mind.
I saw you put your hand, anyone who didn't see Marianne put her hands up in the air and waved them really delightedly then. Sorry, Marianne, go on.
It just validated my existence there then. The truth of the matter is, I do get people coming to me, and I'll never forget this one person who was about to embark on transition, and I like a good metaphor, and they just said that I feel like I'm holding a hand grenade, and if it goes off, it's going to blow my life apart. And as a therapist, I said, well, shall we keep the pin in and we'll talk about it? And if it does have to go off, let's try and minimize the damage. It doesn't have to blow your life apart. It might, hurt certain parts of your life, but it doesn't need to blow it apart. And I just thought that was a great way to describe how people feel when they're embarking on this journey, that this is going to blow my life apart, and it doesn't have to. It seriously doesn't have to. And I think, obviously, I'm going to be pro therapy. I think good therapy can help people to see that and manage it in a way that they can minimise any potential damage. So it was nice to hear you say that.
Very nice. I'm aware of the time, and I'm sure we could talk for hours. I wish we had a bottle of wine and we could sit and share it and talk for hours, but we can't. Sofie, it's been really, really, really lovely talking to you. When I came on, I thought, okay, we're going to just kind of repeat the podcast and expand on it a little bit. But we've covered so much ground. It's been really, really useful. And what I'm going to do is I'm going to ask our doctors over here to listen to what we've talked about today and listen to what impact a small prescription of belief and a small prescription of HRT, just a small one, and what a difference that can make to allowing someone like you to live your life. So thank you so much for that. And I'm going to thank any doctor that is empowered by listening to this to help their patients. I'm going to thank you on their behalf as well. And a quick high five to your therapist as well, because she's a special person. So Marianne, join me in saying thank you for joining us from so far away and sharing your experiences. And I hope that we're all alive when the UK catches up and joins your model.
It will be there, and have faith. You will move in the right direction. It's the only way to move. It will happen. And thank you again to both of you for having me on today. It was a marvelous experience telling you my story and expressing a bit about how things are done over here.
It's been a privilege, Sofie. Thank you for joining us.
You're welcome.
Thanks so much. Bye-bye.
Okay. Bye-bye.
Bye-bye.
Thank you so much for listening. I really hope you've enjoyed our programme today. Please go ahead and subscribe to future episodes if you haven't done so already. If you or anyone else have been affected by any of the things that we've talked about in our podcast today and you'd like to contact us, please visit our website Help Centre and contact us via there. We're very happy to accept ideas for future episodes and future guests, so let us know if there's anything specific you'd like us to cover. You can also visit our website GenderGP.com for a multitude of information about transgender health and wellbeing issues. You can follow us on social media. ID is @GenderGP, and you can sign up to our monthly newsletter. Full details can be found in our show notes on our podcast page. Thanks for listening, and see you soon.